Good.
We're good to go.
Good. Perfect. Thank you. Good morning. I would like to welcome everyone to the Cuyahoga County's Women's Health Commission meeting. Today is Thursday, February 19th, 2026. We are calling this meeting to order at 9:03 a.m. I'm excited to see we have a few more committee members logging in and joining us pursuant to a previous meeting where we voted and were able to pass. We are holding this meeting virtually. Today, we thought maybe because of the weather, we're actually having okay weather here in Cleveland. So we're excited about that, but happy to see everybody join us virtually this morning. We're going to move right into roll call. So I would ask the clerk to please take the roll call.
Okay, Dr. Lauren Bean. Great, see her on the call. Heather Brissett.
Here.
Great. County Councilwoman Conwell.
Present.
Great. Emily Campbell.
Present.
Dr. Melanie Golombowski, let me know she's not able to join us today. Councilwoman Tennille Kaus.
Here.
Jasmine Long, we heard, is not able to join us today. David Merriman is not able to join us today. LaShawn Carson is here on behalf of Dr. Moreland. Great. We have Mayor Nickerson, not on yet. Okay, Sabrina Roberts on behalf of County Executive.
Here.
Great. Then we have Councilwoman Jasmine Santana was not able to join, as was Mayor Thomas. Unfortunately, we seem to be bumping up against some travel. So I don't believe we have a quorum today, Chair.
Thank you. Thank you for all those who were able to make it today. Although we don't have a quorum, the only item that we formally had to vote on today was the minutes. So I will suspend that and we will vote on that at the a lot of great discussion items and some education pieces that we would still like to move forward with today. Before we jump into some of the rich discussion that we have planned, I would just like to take a moment of silence and reflection based on the contributions and challenges faced by women across the world. We know this month also is Black History Month, and so especially thinking about women of color, specifically African American and Black women. And although we don't meet formally in March as a whole committee, we know that March is Women's History Month. And so taking the time to acknowledge these two important months and what that means to our country and what that means to the world. So if we can take a moment of silence now. Wonderful. Thank you so much for that time to reflect. As I said, we're going to move past the prior meeting minute approval because we don't have quorum today, and we will bump that to our next meeting. Clerk, is there anyone who submitted public comment for the meeting?
No public comment was received.
Thank you. The meeting is now open for new business. We are excited to have the Center for Community Solutions. I would like to start by inviting Natasha. And Natasha, can you please pronounce your last name for me? Thank you.
Yes, it's Touchy Michael.
Thank you, Natasha Touchy Michael, from the Center for Community Solutions to take the floor and share an overview of the issues brief that she's working on for the commission. So we're excited to hear her present this morning. Thank you.
Yes, thank you. I'm going to share my screen, so let's see. Okay. Can everyone see the slides? Okay.
Yes.
Worked great.
Okay, is it in the okay, great.
Center mode.
Yeah, it's in the right mood, like it's in the right like move without seeing my notes and all that.
You got it.
Okay, just making sure. Thank you. All right. So, thank you for having me today. I'm going to talk to everyone about a current project I am working on. And again, my name is Natasha Teshimaika. I am the Troy Hall Fellow in Health Planning at the Center for Community Solutions. So I focus a lot on health disparities across the lifespan. So if you have any questions about that topic or just a topic I'm going to talk about in a few moments, please let me know. This is my email address. And I'm sure most of you have heard about the Center for Community Solutions, but for those who hasn't, we are a nonprofit, nonpartisan think tank that improves health, social, economic conditions through our nonpartisan research, community communications, policy analysis, and advocacy. And this is our agenda for today. I am going to go over the current state of reproductive health in Ohio, followed by patterns of reproductive health topics that I noticed in my research, and then the next steps. All right, so in regards to the current state of reproductive health, what I noticed online just by simple Google search of like reproductive health in Ohio in the news section, there is still a lot of information about abortion. As we know, a few years ago, Ohioans approved issue 1 that protects reproduction decision making. Currently, there's a House bill that restricts Medicaid funds to NGOs. It's currently in the House. There hasn't been any movement yet, but if this bill is passed, then this could impact possibly the NGOs who services low income, underserved areas that focuses on reproductive health and family planning. So as you can see by this screenshot, these are the headings from various news sources. But what about other health issues in reproductive health? What about period poverty or fibroids or perimenopause and menopause? So these are the patterns that I noticed when I looked up those specific health concerns. The first pattern I have noticed is that there is a lack of research at the state and local levels. Much of the information I have found was based on national and regional levels. I only found one article, scholarly article about menopause in Cleveland, which is actually outdated. It was published in 2002, and it talks about the woman's understanding about menopause and their experiences, so more like a qualitative study. And I also saw an article, scholarly article based in Toledo, getting young people's viewpoints about period poverty. Were they able to afford period products, and their other thoughts in regards to that. Another pattern I have noticed in my research is that health disparities are present among all of these issues. So, for example, when it comes to period poverty, um, if girls of low economic status cannot afford menstrual products, that could possibly lead to missing school, which unfortunately, if this becomes a more of a habit, they will get poor grades, which leads to a possible school drop off out. The prevalence of fibroids are higher among Black women compared to white women. And then also, Black and Hispanic women experience menopausal symptoms almost as 2 times longer than white, Chinese, and Japanese women, according to a couple of studies. And that actually means um, Black women and Hispanic women can suffer from menopausal symptoms for 10 years longer. So that is an alarming statistic I have noticed. The third pattern I've noticed when it comes to legislation, there's not a lot on reproductive health issues when it comes to policy, but it just depends on the levels of legislation from like national to like local. So, for example, there is some fibroid legislation on the federal level, but not in the state level, or it's just throughout Northeast Ohio. U.S. Representative Chantel Brown did introduce a bill called the Uterine Fibroid Intervention and Gynecological Health and Treatment Act, or the UFIGHT Act. And with this act, the Secretary of Health and Human Services would award grants for education to increase early detection of fibroids and to also spread awareness about it. There is some legislation about period poverty on the state level, but hardly on the federal level. So at the state, House Bill 29 was passed, and it was recently signed into law. And this is in regards to inmates getting access to feminine hygiene products. Another thing I noticed is that there's a lack of standalone legislation around perimenopause. However, when I do look up some legislation about perimenopause, you usually see some language tied with menopause. So they kind of are like tied together, not separate. So what's next from all of this research I've done and I'm continuing on digging into? So over the next few months, I will release some issue briefs about these particular topics on period poverty, fibroids, and perinatal menopause with menopause. The first brief will be on period poverty, will be released next month. Next week, there will be like an introductory article, just level setting the whole project on 5 things you need to know, our newsletter. And I will also highlight the health disparities and also just using like a belonging and inclusiveness lens, just to show like the importance of these issues when it comes to people from different backgrounds. And this is just more information about how it's going to be set up for each issue. So first, I'll do some level setting about the topic. So what is the reproductive health issue? How does it impact individuals across the lifespan? And then I will talk about certain statistics, whether the statistics are based on a national level or more of a local level. Then I will talk about health disparities, mainly disparities of those issues, period poverty, fibroids, perimenopause or menopause, between races and also between income and other disparities. After that, I will go into some legislation, just trying to highlight if there are any bills or laws in place surrounding these issues. Then later, I will talk about health insurance. Is health insurance or Medicaid or private insurance covering any of treatments concerning these health issues? And then finally, I'll present some solutions if there are any solutions that we can handle from there. So this is our QR code for 5 things you need to know, our newsletter. If you are interested in signing up for our newsletter, if you haven't, please do so. You can be on the lookout for our issue briefs through there, or you can just go on our website and click on the subscribe link. If you need help with that, I can let you know how to get there. And thank you so much for allowing me to spend time with everyone this morning. I am open to answer any questions.
Good morning. Thank you for that wonderful, informative presentation. I wanted to know, do you by chance know why the prevalency is higher as it relates to fibroids for African American women or Hispanic women, and why it tends to last 10 years longer than our counterparts?
Yes. so I'm still doing some research in regards to that. But what I have found so far is, of course, systemic racism has to do with that and the social determinants of health, and just like also like in that was based in Cleveland, for example, which was outdated, but I'm sure it's still relevant to this day at a certain extent. That sometimes we don't really like, we just think of it as, okay, this is normal for us to go through, like having hot flashes or having issues with it, brain fog. Oh, like this is normal. Like, oh, this is not something alarming. Um, so that's one of the reasons why it seems like that's not like well known, but back then. But I know that now people are talking about it out in the open more. So, like yesterday, for example, the Cleveland Metro, I mean, not Cleveland, but Columbus Metropolitan Club had a forum, and they had different OBGYNs and different health professionals that talked about like the importance of perinatal pause and why in menopause and why people are finally talking about it. They described that people are now realizing that um, womanhood is not just about giving birth, and there's still life after giving birth, and there are other health issues we needed to take into consideration. So there's more awareness about it now. More people are talking about it.
Okay, thank you for sharing that. That all makes sense.
Mhm.
Thank you so much for the presentation this morning. Very informative and will be helpful in our work as we move forward as a commission. One of the things that I was interested in was period poverty, and specifically as it relates to um, individuals incarcerated.
Mhm.
And that state legislation. So recently, I'm a councilwoman for City of Shaker, and many people don't know this, but we do have a jail in Shaker. We rarely use it. We normally partner share with Solon or Beechwood. I forget one of the suburbs, though, one of the other suburbs. But occasionally we do have to use our jail, and it is still fully functional and operational, et cetera. And so I recently took a tour. And I specifically asked them about if there was a female inmate that we were housing and if we would have menstrual supplies for them, and if they would be at a cost or would they be given that, like they're given soap or shampoo or different other needs. And so I got to talk about that, locally with our police department. But I'm wondering, that state legislation, does that apply to municipalities, or would we have to, as legislatures and as advocates for this work, be looking at Cuyahoga County, the municipalities, and making sure that they're providing menstrual supplies to uh, individuals who are incarcerated that need those?
Yeah, so in the language, it does include municipalities. So municipalities and also the state should be able to provide menstrual products. The bill was recently signed into law, so I'm not sure as to like when the effective date is, but yes.
Tennille, I can add a little bit to that too. So in the Ohio Revised Code, it does not say anything in the jail standards about providing menstrual products for women in jail. Obviously, it is I mean, you can't not provide them, like women need them, but it's the way that they're provided sometimes that can be very disparaging for women. Like they have to go and ask every time they need a pad, or they might be using toilet, like there are provisions for it to be a product that's there, but it's not, but again, it's like, it's the way that it's kind of distributed and the way that it's approached that can vary, by jail, and it can be very demeaning for women to have to, go ask every time they need a pad, for example.
Yeah.
And
Yeah,
they can buy products are available on commissary too, like tampons, for example, might be available for purchase at commissary, but they would provide, pads or what have you.
Okay. Yeah, I think that's interesting. And I also, as you talk about possibly tampons being available in commissary, but pads being available free at cost, that brings up socioeconomic issues and concerns for
For sure.
women and their family, as well. So if you come from a more affluent or wealthier background, you can afford, I guess, the luxury, I guess I would say, of a tampon compared to a pad. So this is, just the education piece on this, I think, is interesting. And I'm wondering, if there's some standard or some guidance that we could suggest, obviously not require, but suggest I'm sure I don't know if the county has done something specific for the county jail, but that might be something that we could share with our municipality jails that are housing people more short term, and different things like that, possibly as a best practice. I would definitely want to share that with where individuals who are taken into custody in Shaker and where they go. I would definitely be interested in sharing that with our partners.
Yeah, I can get access to the policies actually on both sides, but the medical side definitely has policies in relation to that. And the National Commission on Correctional Healthcare too has guidance and best practices too on those types of things too.
Yeah, I think that's a place where we could possibly make a real difference, a early win. Sabrina?
And I want to jump in on, while we're on period poverty, because I know we're going to move soon. We just met with, and I don't know if the whole commission knows, is it Wendy Jones from I Support Girls? And we've been talking as a commission about providing for the schools. And I think when you look at the data that was just presented, looking at socioeconomics, it would be interesting, and maybe our friend Katura or Agatha has some sense of, through school districts, who has the products available and who doesn't, and the methodology by which the young person would request those. As I was hearing you talk about folks that are in our care or yours in the city of Shaker, what does that look like for our young people in school in this mass, kind of operation? So we did have, she couldn't make it today to this meeting, but we do want her to present to you because she is affiliated with a national group and already packs period products. The executive and I were at the MedWish MedWorks free clinic in November. There's at least 1,000 people served. They were set up passing out period products, and people were very, very appreciative. And they were like, oh, when I don't have enough money, this is great. So as a emergency pack, and then for their, young daughter at home. So just wanted to add that since we were on the period.
Yeah, absolutely. I thought, and I could be incorrect here, that there was state legislation passed maybe 2 or 3 years ago that requires schools, if they, maybe not all boys schools, but if they serve a female population, to, and I'm sorry if my terminology isn't quite correct here, but to have sanitary supplies, menstrual supplies available. Do we know if that is?
So I won't mention a school district, but I was at a school district for some reason on a weekend, and I went into the ladies' room. There was hardly any toilet paper. So, in practice,
I get
things
it.
are on the books, laws are on the books, rules are on the books. But I think this commission, spot check, let's go visit or have our young people tell us. It's one thing to have a rule on the book, but is it so? It's just
absolutely.
And Chair, I know you got to keep rolling with the meeting here, but just jumping in and hi, everybody. I've always appreciate these commission meetings and learn something new every time I'm in attendance. I wanted to say to you that as we work toward the new jail, which we should break ground on in the second quarter of this year, the policies that you just brought up relative to the equity of period products, working with Laurel, Sabrina, and our project management team on the jail, I think you make a great point. And I always say if I can take away something from this commission meeting and take it to a policy conversation, I will do that. And I will do that with the jail planning team. Because your point about inequities and access to specific period products, it's a very important point. We have the same different universe, but we have the same issue going on with tablets that are tablets that people read periodicals from and get their news and communicate. And we have the same equity issues about there's been discussions about subscriptions. Well, we want it to be accessible to all, and so I will bring this forth. The other thing on the conversation you were just having with Sabrina, and totally respect that there's policies and there's actual action and practice, but I think the Superintendent's Association is a catch-all. You could quickly get everybody to understand what the policy is, probably maybe we could help with that, work with their staff to see what the policy is. And if it's insufficient, we'll see if we can lobby to change it. So thank you.
Great, a lot of good discussion. Natasha, I saw you come off from mute.
Yeah, I was just wondering if anyone else have any questions or resources I can share.
Thank you.
Yeah, absolutely. Thank you. Just rich discussion from the presentation this morning. And sometimes at the commission, we might think of something at 3 a.m. and we'll definitely reach out to you if we do the way our brains work sometimes. So once again, thank you so much for all the information. We are going to move right along to keep going on the agenda. So once again, thank you, Natasha and Emily, your whole team at the Center for Community Solutions. Your work in Northeast Ohio, around the state, is just invaluable, and we're so happy to be able to use the work on the Women's Health Commission. Our next item of business will be updates from our two committees, Mental Health and Physical Health. Both groups met in January to do further planning on the initiatives that they would like to undertake in 2026. I now invite representatives from each of those committees to share reports of the initiatives that were discussed with the full commission today. We will begin with Heather Brissett as a representative from the Mental Health Committee. So thank you so much, Heather.
Thank you. Good morning once again, everyone. I am happy to share a brief update on the work of the Mental Health Committee over the past month. We're truly excited about the direction of our 2026 initiatives. They reflect our ongoing commitment to community healing, raising awareness, and empowering women throughout our community. One of our major initiatives is a podcast collaboration. The County Communication Department is relaunching the Ask Cuyahoga podcast series, and they have invited the Women's Health Commission to partner with them. Our first episode will introduce the commission, who we are, why we were formed, and the work we're leading. It will be an interview-style conversation featuring our chair, Tennille Kaus, and Councilwoman Yvonne Conwell as our representatives. We are planning for a late March release to align with Women's History Month. Recording will take place early in March, and the County Communication Department will support promotion. You may recall that we had initially planned a grief-focused episode for March. We have decided to move that to July. This allows us to first establish the podcast platform and gives us additional time to thoughtfully plan the grief conversation. For July, the episode, we are exploring inviting community experts to help guide the discussion. We are also considering broadening the scope of the grief and potentially making it a theme throughout the year, allowing us to approach it from multiple perspectives. The committee will continue to meet to refine the format, confirm guests, and ensure alignment with our broader strategic priorities. Overall, the Mental Health Committee is energized about the momentum we are building and the opportunity to expand our impact through meaningful, community-centered conversation. That concludes my report. Does anyone have any question?
Seeing no questions from members this morning. Thank you so much, Heather. I am on the Mental Health Committee, and I'm very excited and looking forward to doing that first podcast with Councilwoman Conwell. Oh, will be exciting duo together, hopefully. So we'll do our best, but we're looking forward to that and getting that scheduled in the coming days ahead. So thank you so much, Heather. Next, I'm going to talk about the Physical Health Committee. I had an opportunity to attend that meeting as well, and there's a lot of exciting work being done on the Physical Health Committee that we talked about this past month. We're very excited about all our initiatives for 2026, but now we're going to focus specifically on the community health event on the east side. If you remember, we were going to try to target one on the east side and one on the west side. We will be doing the east side one. The east side one will kick off the series. The initial event will be led by Councilwoman Turner, Councilwoman Kaus, myself, and Mayor Thomas. Mayor Thomas kindly suggested the Richmond Heights Recreation Center as a location for the event. The facility can accommodate approximately 200 people and offers a central, accessible location for Eastside residents. So we're very excited about that space and appreciate her offer. The committee discussed holding the event in June in order to avoid the busy time for many families at the end of the school year. Following the survey that was sent out to commission members, June 11th has been identified as the ideal date. So I'm asking if you're able to, if you aren't traveling yet, et cetera, if you can hold that date, because we would love to have, the commission come out and really support. The clerk of court will circulate a save the date to hold so commission members can hold their calendars, but I know how fast your calendars fill up. So please hold the date right now. Thank you so much. Several potential topics were also discussed by the committee during the meeting. In a post-meeting survey, the topic that received the most votes were heart disease, and we did just do Go Red recently, mental health and emotional health, and perimenopause. So that perimenopause keeps really coming up, and Natasha even touched on that a little this morning. We would be happy to hear more feedback and discussion about potential topic ideas from this full group, though, this morning. Whenever the topic is officially chosen, we would like to consider partnering with multiple health systems and expert providers to prevent a unified and collaborative front. Overall, the Physical Health Committee is really excited about putting on this event, and we're happy to answer any questions or take any feedback, especially about potential topics at this time. Thank you so much. Opening up the floor.
What was that date again?
Yes. I'm gonna ask the same thing.
June 11th.
But was there a specific time?
We don't have a specific time, but I believe it'll be early evening is what we discussed. So maybe say from 4 to 7. Although that's not the official time, but it just feels like it'll be.
Block that time. Block that time.
Yeah. It'll be like an after work event. That the 4 will give you a little travel time to Richmond Heights if you aren't on the east side, etc. So.
And Councilwoman, you said Richmond Heights at their community center?
Yes, Mayor Thomas was gracious to provide that space. So it's the Richmond Heights Recreation Center.
Gotcha.
Other questions or thoughts? Did anyone specifically, you heard me read some of the topics. It was heart disease, mental and emotional health, and perimenopause. Were there any topics that rose that you thought about that we would want to add?
Chair, Council,
Yes.
there was an overarching one in discussion that I'm blanking on now, that the topic would then encompass like 2 or 3 that we've discussed. It was hormones or something through the lifespan, and then you could hit perimenopause, menopause, and a couple of
So
them.
was it reproduction?
No.
Fibroids.
We'll check in with Dr. Golem.
I have it, I just need to pull it up.
But it was something that would like encapsulate like
Okay.
a couple of them,
Mhm.
since we were kind of all over the place.
And that, yeah, I can't remember the overall topic, but I do recall that because we were saying we could get a doctor, a physician that possibly specialized in this, that, and that,
Yes,
yeah, and
yes.
kind of have a multiple panel with
Yes.
the different
So-
areas of expertise, so, yeah.
So at our next committee meeting, we'll kind of
The
center.
topic was hormones across the lifespan, puberty, perimenopause, and PCOS.
Yeah.
There we
It
go.
just didn't rise to the top on the form, so it didn't
Yes.
make the top.
Well,
But
I think
that
that's how many
makes-
people filled out the form.
Yeah.
I don't think we had a lot of people fill out the form,
We
so
did
it's a
not.
little skewed. So we have to go back to the drawing board with the committee.
Yes.
Yeah, but that makes sense. Then we would hit multiple age groups because as we know, as we've identified as a commission, we want to make sure it's inclusive in terms of age groups as well, when different issues obviously affect women at different ages. So I really like that. Thank you. Other comments or questions about the physical health committee? Great. It
Well-
seems like I'm sorry. Did I hear
I was
something?
gonna mention, what came to mind, a topic that we should consider addressing is diabetes. Diabetes is very prevalent in our community, and educating individuals on preventing diabetes would be helpful. Also, having support for those who do have diabetes. So if possible, if we could explore that, that would be helpful.
That would be interesting too, because we could possibly bring in a registered dietitian as well to talk about the diet side of helping to manage and control. So thank you so much, Heather, for lifting that for us. LaShawn?
Yeah, so along with diabetes, if we can control diabetes, that would avoid dialysis. And as you know, dialysis is pretty prevalent in the Black community, in all communities, shall I say.
Yeah, across the whole county, we struggle with that. But, I'm thinking about the other part of my work on First Year Cleveland. We were talking with some folks in Cincinnati. And one thing and I myself had this issue, preeclampsia. And when we talked about the heart health and all that, blood pressure. It's rampant,
yes.
and people really don't understand blood pressure. I never had a blood pressure problem before I had my child, but because of my child, I will forever have high blood pressure. And where it comes from, why there's such just an unknown. So as you talk about diabetes and blood pressure, it is then driving, as people know, prematurity is the biggest driver of infant mortality, and a big driver of prematurity, particularly because the numbers are off the charts for Black women, preeclampsia. So we're doing some work on the other side, and Emily, as chair of that group, we're doing some work on that side, but just in the lifespan, just understanding blood pressure, diabetes, and then these hormone, there's a lack of knowledge. People that are educated don't even quite understand it. So to tie those two pieces together, because a lot of information just came out again with our bad scores on infant mortality and premature birth, it all goes together.
I want to speak to that as well. Heart and stroke, you know, that all kind of ties in. So they also want to put stroke on the table.
Absolutely. Women's heart issues is what's kind of rising up in the different aspects of that. I saw Emily as well. Did you
Yeah.
want to
Thanks, I do, and I think this flows nicely from the conversation we were just having. You know, when I think about the events that we are looking to plan, keeping in mind that we want these to have broad appeal, we want people to be able to come and learn, we want women and girls and others to leave with something that they can do, or that will help them. And so I would recommend that we keep things pretty broad, and rather than on things that have a lot of medical interventions or require quite a bit of medical intervention, you know, things that can help women be their own advocates to get the right tests and treatments, things that women and girls can do on their own that like isn't just one more thing to do, but you know, some of the links between mental health and stress and physical health, and what are the things that we can do on our own in our own homes and communities in order to help ourselves, our friends, neighbors, mothers and daughters, would be where I would really like to see us focus these particular events. And then from there, you know, we can figure out other opportunities to have more specific and focused things for those portions of the community that could really use them. But keeping this one nice and broad and big and empowering is the word that comes to mind, is how I would love to see people leave.
Your point is well taken, Emily. Along that line, I would recommend if we do something along nutrition and exercise, why it's important to exercise, why it's, you know, eating, how to eat healthy, how to prepare quick meals. So having cooking demonstration.
Yeah, you got it. I mean, yep, you're right there. Thank you.
You know, okay, I'm going to put on my Place Matters hat and go in my bag about social determinants and what they are and what they're not. Yes, eating good, exercise, all that is well and good, but the stress and the weathering women have to navigate this life. So this is where the mental health piece, you can exercise and you can eat healthy, but there are systemic things happening to people, and you have to have a place and a safe space. So yes, make it big, but it still has to be what was so powerful about Councilwoman Turner's event. Yes, you had different topics, but we have to balance, because it was the inner sister circle that captured, and people were crying at every age from 20 to 80 and comforting each other. So we gotta, in this next committee meeting, find what is that balance, because what we do know from all sorts of studies, you can still do all those things, but it's that connectivity tissue, blue zones. How do you get to a blue zone? You can do all those things, but if you don't have connectivity and community and less stress, all the rest doesn't matter. So how do we find that balance?
Yeah.
Particularly in that neighborhood on that side of town.
Yeah.
Madam Chair, can I ask a question? I just want to applaud you for the work already and the thoughtfulness about the we're calling it a health fair, but what are you calling it? What's the word?
We're trying to shy away from a health fair, maybe a community conversation.
Okay, good.
A little bit different.
Yeah, and I think that is good. It just feels like it might be the first of many. I use the Office of Violence Prevention as an example that's out doing district by district, council district by district, listening tours on violence prevention with Maisha Watkins, our director there. I don't want to get ahead and just kind of thinking though, as you guys are talking about so many different aspects of health, from heart health to healthy living and cooking, and perhaps there's a series, and I asked this with the question of funding, and I can't recall, is our commission endowed?
Yeah.
Good. So, I mean, if you have ample funding, all the better, but it seems to me to get equity across the county in terms of geography, as you do Richmond Heights, you might consider, I'm just throwing out some, communities, but you might consider around the bend something on the south side of the county and the west side of the county and the west side of Cleveland and the east side, but I say that hoping we have funding to do that. But and I know this is a volunteer group for the most part with some staff support, but it just feels right what you're talking about doing, and I applaud you for it, to get people out to talk about women's health. So
yeah, we are fortunate to have funding, and I know that Mayor Thomas thought that we could get some in-kind donations from some of her partners that she regularly partners with in Richmond Heights to make the event even more successful. So I think she's working on that from her side. And we're definitely coming to the west side, I think, in the second half of the year. And then I think we can continue to look at to expand to the south, the north. I'm not quite sure how you break up the county, but we definitely want to touch as many communities as possible because it affects women all over Cuyahoga County.
Right.
Now.
We can obviously help on that effort, and working with Councilwoman Conwell as well. Just I think what you're doing. I just appreciate you guys. We came in with a framework of health on this administration and the Women's Health Commission. I talk about you all the time. That you are doing great work, and meeting people right at the ground level where they're at. All the better. Can I say I'm getting pulled, but can I offer one other item? And I could work with Sabrina and Laurel and Audrey and Agatha on this, but we got a call from Denise Driehaus, who's the commissioner, Hamilton County Commissioner. She's also this year's chair of the County Commissioners Association of Ohio. Really happy for her. She's a good friend. I'm just going to read what this is, but she asked us to engage, I think, on like a luncheon, but I'm more interested ultimately in maybe the two commissions perhaps zooming like we are now with each other, but out of Hamilton County. It's a slightly different group, but the Hamilton County Commission on Women and Girls was established in 2017. It works to eliminate gender-based discrimination and promote leadership opportunities in Cincinnati and surrounding areas. It comprises 20 women and 10 student members who advise on policy focusing on pay equity, workforce development, and safety for women and girls. The mission and purpose of the commission aims to eliminate discrimination, foster leadership, and bridge gaps in economic, social, and political fields for women and girls in Hamilton County. I realize the mission is different from the mission of this organization, but they do seem like kindred organizations relative to creating equitable outcomes for women. Would you ever be interested if we kind of maybe had a listening tour from what they're doing and vice versa for them to us? Okay.
Absolutely. I see a lot of
heads
nodding. Yeah, I think that learning from each other would be a great opportunity.
Terrific. I'll make that suggestion to her then based on your reaction, and talk to Commissioner Driehaus about connecting the two groups.
Wonderful. Thank you for the opportunity, Executive.
Can I ask a question to County Exec? Can you hear me?
Yes. Yeah, I can hear you.
Good morning. So just wanted to know in terms of funding. So when you had this initial thought for this Women's Health Commission, are you thinking about funding the various projects that might, as we work with different community partners? Is that where the funding, like for food or little small things like that? Or were you thinking about putting that in the budget on a regular basis?
It's a good question, Councilwoman, and I'm asking colleagues here about our bank account and balance. I believe, thanks to your help as well, we put an initial endowment in the commission. I don't know if anybody knows
Community.
where that's at.
Community solutions.
Yeah, Emily, do you know kind of generally what went in and what the fund balance is?
Yeah, so the dollars that we're able to deploy to support some of these activities are from a grant that was made by Cuyahoga County several years ago to the Center for Community Solutions, that was initially meant to ensure that Cuyahoga County residents had access to a wide array of reproductive services in the face of a statewide abortion ban.
Yes.
Now, since things changed in the interim, those dollars continue to be at the Center for Community Solutions, and we've been partnering with Cuyahoga County and with this commission to identify the best way to deploy them. So they're to answer your question, Councilwoman, they're one-time dollars that we've got to spend. I believe this year is when they have to be spent, because if memory serves, they originate from the ARPA pot. Is that correct? Great. Thank you. I'm glad.
You did a much better job of remembering things than I would. And thank you. That's
Well, it's on our bank account. So, And so there are a number of things that are in, the original grant, the original legislation that went along with it. And so a portion of it we can deploy for some of these, and we have some ideas about how to do that and do it quickly in ways that we spend the money once and it continues to support our work over the course of time. And then there are funds, the majority of the funds are meant to be deployed to community organizations and those doing the work directly. And so stay tuned in the next little while for how we'll be able to get those dollars out into the community doing good work. Sabrina, County Executive, did I cover that okay?
Yes, especially the genesis of it. And to Councilwoman's question, it was exactly what Emily said. Originally, I mean, the sort of formation of this came from actually the Dobbs decision, and I said coming in, we wanted to put this together, and then you guys ran with it. It's your baby, and I appreciate what you're doing with it. I thought the initial allocation was something like 475,000, and I'm sure we spent some of that down. But Yvonne, want to work with this team here on proper deployment of the dollars. If there's any wiggle room on that calendar date as to when we have to have them deployed, we could investigate that a little. Emily, I guess Sabrina oversees that contract. And then, as you guys talk, I just think of outside potential funding partners, some of our hospitals, to the extent we want to go that route or wherever. It just seems like even for what you're doing with these conversations of consequence about health in the community, women's health, we could maybe augment our own fund with other people's, financial support, which happy to do. I got a roll on that, but Yvonne, we can work with you on building that fund out a little bit.
Yeah, I was wondering if there's grants and things like that. I know Sabrina is real knowledgeable, and if we did get off into that realm of seeking grants after the other funding's gone, who would be responsible for that? And that's a heavy undertaking sometimes. And I would assume community solution.
Wondering, it never hurts, as those of you that are in the nonprofit space know, to do a little fam tour with foundations, even if you're not asking them for anything at the outset, just familiarize them with what we do. I'm sure there are people at Gund and Cleveland and others that would hear us, what we're up to. So maybe we could, in the not too distant future, sit down with a couple of foundation program officers in the space. Marcia Egbert comes to mind at Gund, and Kathy Hallisey at the Cleveland Foundation, who have direct tentacles to health and human service work. So.
Yeah, absolutely. Thank you so much, Executive. We
Thank you for all
appreciate
you're doing. Back at you. Proud of you. Thank you.
Thank you. Great. Encouraged by the discussion and recapping the funding, which is going to obviously be important in moving the work forward as well, and encouraged by the talk of future funding with looking at grants, looking at foundations, etc. So thank you everyone for bringing all of this to the table. Really appreciate it. Other discussion, either around funding or around physical or the mental health committees or anything broader for the group?
Well, I just want to say in terms of a little update in terms of the domestic violence women's series. Me and Molly are almost there. It's good to plan early so everything is in place in October. Just to let you guys know that every Thursday, we have something for every Thursday in October. And it will be at the Journeys. Am I saying that right? I have to think of everybody changed their name at the Journey Center from 5 to 7. So we are working on the agenda or getting confirmations of people that will be there. I think the only holdup, and Molly keeps me on task, is finding survivors to talk about their story. And we think we have 3 dynamic women that would like to express what they went through. And I think one will actually speak in terms of, they have not confirmed yet, so one will actually speak toward being a foster child, and the domestic violence that she experienced. One where I guess it was in her household of growing up or marriage, first marriage, and now she has a wonderful marriage. And I can't remember the third. So we're kind of thinking about doing a little something different, like maybe usually I just have one person to share their story, but it can be an emotional night. It can really be an emotional night, and maybe from some help from you, sisters, we could think about if we could find someone. I've never had this before, but maybe someone that's good with psychology or therapy. Heather, I'm thinking of you. Maybe we can have somebody there that evening for that emotional. It's very emotional when they, for the people that are listening, as well as the person that has experienced it. So that would be something that I would ask you guys help on. We've never had that before, but if they're going to do kind of like a panel with more than one story, that's going to be very, very emotional. But we're on task. We're months in advance. Our next step after they confirm, we will get Devin to work on the flyer, and everybody will have it. But at least to block off every Thursday from 5 to 7 in your calendars now. There'll be something dynamic each night.
Wonderful,
Councilwoman,
thank you.
Councilwoman and chair. Audrey's gonna put them on our calendar, so even if you can't, at least it's there.
Okay.
Thank you so much.
Councilwoman and chair.
Thank you so much, Audrey, for getting our calendars updated, and a special thank you to Councilwoman Conwell for leading this initiative for the commission. We know that domestic violence, unfortunately, is prevalent in the community, and being able to learn from that and understanding more. So thank you so much. And we will think about and draw on resources. And I believe that Jasmine Long, does she have grief specialists?
Okay.
Yes, with her organization. So I think we want to bring her into the loop since she was unable to make it today, because that might be a good, as you were asking for support there for individuals attending. So, and then as you said, Heather, of course, has a lot of resources as well. And I think working through those 2 avenues, we should get to where we need to be. So wonderful. Thank you so much, Councilwoman Conwell.
And can I
Yeah.
just share that that's also breast cancer month, October is. And so my sorority that I'm working with also plans to make sure that they have table and resources. So that can be kind of like a dual thing, so we can cover two things in October.
That's
Wonderful.
excellent. Great.
Very excited.
And
What,
maybe
can I ask what sorority it is? Not to get into sorority wars.
Swing by swing. So we're HBCU, yes.
Wonderful,
We're not.
wonderful. Other comments or questions? Thank you so much for the update, Councilwoman.
I don't know, this is one thing I would say to the clerk to make sure we bring up in the mental health committee to keep in lockstep. We have the grief piece and we're gonna run that thread, maybe connect for the fall, the whole domestic violence theme and breast cancer, so we stay on theme and connect it all. So, I don't want to forget.
Yeah, I think in the mental health, if I'm recalling, I don't have my notes in front of me from that committee meeting, but we even talked about the grief of possibly having to lose a breast to breast cancer.
Yes.
And different things like that. That's maybe not
Yes.
traditional grief that we always think about, but grief nonetheless and stuff.
Just to time it up,
Mhm.
either during or leading into her event that she's leading.
Absolutely.
So.
Absolutely. So much great work being done. And I want to thank everyone. As we know, this is a volunteer type of position, but we know the passion. I appreciate the passion everyone has for this work. Especially want to thank our county liaisons and supporters. They keep me very much up to date. I know their plates are extremely full. Everybody it knows that this is a very hard time for local government for various reasons. And they are just always helpful, encouraging, and they help manage me, which is really hard to do. So, so I really appreciate them and appreciate all of you today. Any more comments or questions or anything for the good of the order?
I have one very quick update, if you don't mind. When we were doing the period product drive last fall, I think, I had collected quite a bit of product from the current leadership Cleveland class, which I drove around with in my trunk for months and finally dropped off, but continued to add to it as I was driving around. And so it ended up being like 2 large bins full of period products to add to the drive that we did earlier, and visiting the physical location that they have in the border of Cleveland Heights and some other communities. I was really struck by the sophistication of the setup that they have there and just the amount of period product that they have available to women in the community.
Thank you
So maybe I'll keep doing it as I drive around. Just grab stuff.
Grab stuff, right? Thank you so much for that update. And can we get an address possibly in the minutes? Can you just stop by and see it, or do you have an appointment? How does that work?
We'll connect with her and see if maybe there's an opportunity for the group to stop by, or we can arrange a time for everyone to go see it.
Yeah, that would be really nice.
Do they have
they have standard like drop off hours that you can see online, but Delicia over there is like super understanding and able to like work with schedules, so they're totally available to schedule a time outside of their standard hours.
Perfect. Can we possibly see it, maybe a field trip for the commission? I think that would be a nice opportunity for us. That would be great. Thank you for that update, Emily.
Sure.
Can I ask a question to Emily? Is that, I know you said it's housed in Cleveland Heights. So how is that dispersed amongst Cuyahoga County? How are we marketing that? And I know we can't market like we want, but how are our community mayors or whatever know that we have this resource in Cleveland Heights?
I don't know. It is a storefront, and I know that they do quite a bit of outreach work themselves. So how about when we go on our field trip, we'll get all the information.
Because I wanted to put it in my newsletter, but I don't want to like blast it if it's, it's not
we'll
something
try to get you some information on that, Councilwoman, so that you have that.
Thank you.
Wonderful. Thank you so much. Good work being done in the community.
One more thing, Chair, sorry. We do have quorum now, so if we want to go back and do the minutes, vote, we can if you'd like.
Did we lose someone?
5, 6, 7.
Because my
Plus
screen.
Sabrina makes 8.
Okay, perfect. If you guys don't mind, let's go back and approve the minutes very quickly. These minutes were circulated to the commission prior to this morning's meeting. I now invite members to express their opinions or make motions related to this topic.
I make a motion, we approve the minutes.
Second.
Thank you. So we have a first by Sabrina and we have a second by Heather. We will now vote on the motion to approve the minutes. All in favor, say aye. Aye.
Aye.
Any opposed? Any abstentions? Let the record show that the motion has passed and the minutes are approved. Excellent. Thank you. Thank you, everyone, for joining us this morning. So many exciting initiatives to look forward to in 2026. The next all commission meeting is going to be held May 28th at 9 a.m. There will probably be some follow-up committee meetings, so look for that information to come from our clerk. We should be past the threat of snow at that point, so we will probably plan to be back in person. Thank you again, everyone, for sharing your time with us today. We're off to a strong start in 2026, and I want to thank each of you for your hard work in bringing these initiatives to fruition for the women of Cuyahoga County. May I please have a motion to adjourn the meeting this morning?
So moved.
So moved. Second.
Thank you. First by Heather and a second by Councilwoman Conwell. All in favor? Aye.
Aye.
Any opposed? Let the record show the motion passed and the meeting is adjourned at 10:09 a.m. Thank you all so much, and we'll see you soon.
Take care, everyone.
You.
All